Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program with your host, Francesca Messiah from Kaleida Health on 96.5 Power 96.5 and WUFO 1080 AM. And if it's your first time listening, I want to say thank you for tuning in and being part of the Great Lakes Health community. Well, I said Kaleida Health. Who is Kaleida Health? We are the hospitals. We're Buffalo General Medical Center. We're Oshai Children's Hospital. We're Gates Vascular Institute. Millard Fillmore Suburban Visiting Nursing Association that practices healthcare in the 8 counties of Western New York. DeGraff Medical Park. And we have clinics on Hurdle Elmwood. That's for adults. We have 2 pediatric clinics located in Buffalo. And we also have two women's health centers, one on Kensington on the ECMC campus, and the other on Niagara Street near Tops Market. We also have 2 long-term care facilities, one in Buffalo on the Buffalo Niagara Medical Campus, and one in North Tonawanda North Tonawanda, which is part of DeGraff Medical Park. If you're interested in viewing any of our videos, you can use our videos for your classroom, for your youth program, for your adults and senior centers, or just for your own personal use. You visit www.kaleidahealth.org/videos. And let me slow down a little bit. That is www.kaleidahealth.org/videos. And before we get into our program today, which we will be discussing a food as medicine symposium that was recently held on the Buffalo Niagara Medical Campus. I just want to mention that on October 14th, matter of fact, that's going to be today, from 10 a.m. until 2 p.m. is an open house for students, for parents to tour with their students. Kaleida Health, 2 of our buildings, Gates Vascular Center, Oshai Children's Hospital will be open for you to walk through, and all kinds of on the first floor, and several hands-on activities. Roswell Park will also be open for hands-on activities, as well as Houtman Woodward. The idea is for students and adults to explore the field of medicine, the field of healthcare. Healthcare is everybody and everyone. All of our buildings are open 24 hours a day, 7 days a week. So please come to the open house and look forward to seeing you. Well, our topic for today, I know I could go on for 3 programs or more, is food as medicine. And we'll be talking about the Food as Medicine Symposium, which was held about 2 weeks ago on the Buffalo Niagara Medical Campus. And we have 3 guests with us today. First, Dr. Kenneth Snyder, who's not a stranger to our show. He's just a wealth of information. Dr. Snyder, could you please give us your title?
Sure. Hi, Fran, and thanks for having me again. And thanks for bringing this important information to our community. Again, I'm Ken Snyder, Vice President of Physician Quality for Kaleida, practicing neurosurgeon and a co-director of health system science for our medical school locally. Thanks for having me.
Thank you. And our next guest is Purnima and Mohan. And could you introduce yourself and give us your title, please?
Hello, everyone. I'm Purnima Mohan, and I'm the Food as Medicine Coordinator with the BNMC.
Thank you. And Beth, could you please introduce yourself and give us your title?
Yes, thanks, Francesca, for having us. My name is Beth Mechnica. I'm the Director of Health and Wellbeing at BNMC.
Thank you. And BFNC is Buffalo?
BNMC, Buffalo Niagara Medical Campus.
Thank you. So let's get started, because I know we have so much to cover. Could someone provide a brief history overview about food as medicine, and what does that mean? You know, people say you are what you eat. You are what you eat. But why is food as medicine so important?
Yes, we're happy to take that. So We're very sick. I think a lot of people probably know we live in a society where it's normal to be sick, and it's the exception if you're healthy. And the cause is what we're eating. So it's food. 80% of the disease, so a lot of heart disease, cancer, diabetes, a large portion of it is preventable through lifestyle. And so food as medicine is all about using nutrition and healthy eating to prevent and treat disease. And so our system isn't really always set up in a way that makes it easy for people, right? So there's a lot of education barriers, access to transportation. We know processed food is really cheap and widely available, and fruits and vegetables are not. So our system wasn't exactly designed with health in mind. And so we really want to make it easy for people to eat healthy, making nutrition and healthy eating easy and accessible no matter where you are in the community.
Thank you. And how about you are what you eat? What exactly does, okay, let's say someone who likes a diet of chicken wings, French fries, wings, and let's say a Buffalo Bills menu, watching the game, French fries, pizza, wings, little French onion dip with chip. What does that mean? You are what would you eat? If you eat like that all the time, what would happen?
So I'll build a little bit off of what Beth brought forward. And first of all, I want to reiterate how blessed we are in the area to have Beth and the Buffalo Niagara Medical Campus team. Beth is a master's in public health and is an amazing community advocate in education and in action. And it's really through her leadership. And Matt Enstis, who's the CEO of the Buffalo Niagara Medical Campus, who's a incredible, trusted colleague and resource to our community, and is all about empowering our immediate community and community around the hospital system to be advocates for their health and well-being. And Beth spearheads really that mission, that group. Beth, through that team's efforts, brought almost 50 nonprofits together and community organizations together to co-learn and co-ask questions about how our diet impacts our health and how can we improve access and education around the importance of that. And I think, Beth, to answer your question, and again, if no one's read Matt's book, City Forward, I highly recommend that in terms of his innovative vision of pulling our community and health system together. But what Beth highlighted is the vast majority of our chronic illnesses, inflammatory-based illnesses, and these are the illnesses that are often what kill people locally in our area. Heart disease, stroke, diabetes, high blood pressure are intimately tied to what we're putting into our bodies. And again, what I love about Purnima, Beth, and the team is they look for evidence-based strategies to prove what things are out there for us to make an impact on those health measures and reverse them. And one of the highlight speakers that they brought in for this symposium is very strategic in how they impact diet or bring diet and preventative measures. They get people's blood tests and current medical conditions, implement a 2-week regimen, and have shown dramatic reductions in cholesterol, blood pressure, cortisol levels, things that we know long-term as they build up impact our bodies in a negative way. And so again, what you're asking is, how does what we eat impact us? It can put us into a chronic inflammatory state, which can break down our blood vessels, which can cause diabetes, which can lead to high blood pressure, and all of those things ultimately lead to an early death for us, and or an inability to enjoy the quality of our lives, including how we think and feel. And so food is intimately related to our health.
Thank you. And you know what? This will stick with me, I believe, for the rest of my life. You said 2 weeks is all it takes to change your cholesterol and your blood and your different levels, like when you do go for the medical, for the screenings and the blood tests? Just 2 weeks?
What I'm really impressed by in terms of the peer review literature and their ability to collect data and publish that data is either a vegetable-based diet, bean, and other, the regional lifestyle, Rochester Regional Preventative Measure Group has been collecting incredible data, and it was shared at our most recent symposium. And it is incredibly surprising to me, the impact and the dramatic reductions that they've seen in people in short time frames. And so, yes, I'm equally surprised and impressed at the ability of our diet to quickly impact those measures that we get and the lab values that we get. I'm sorry, it was
Wow.
Rochester Lifestyle Medicine Institute, and Dr. Burnett who was really a powerful speaker that Beth and her team brought in.
That's amazing. So let's continue talking about the Food as Medicine Symposium. Prima, could you let me, what was your take on the Food as Medicine Symposium? I mean, 2 weeks changing your diet, change your cholesterol levels. What was your takeaway from it?
So this was the third year of our symposium. The first year it was a virtual session over the weekend. The second year we had it at the Center for Bioinformatics and Life Sciences. And this year the symposium was at the Jacobs School of Medicine. We had an array of experts from around the country who were panelists for our 3 different panels that we had during the day. We had a food equity panel. We had a lifestyle medicine panel. So we're not just talking about food, but talking about our exercise and sleep habits as well. And the third panel talked about the private sector and how they need to be talking about food as medicine versus using processed food. We also had Crystal Peoples-Stokes and Mayor Brown address the group as well, which was amazing. And our 2 keynotes were Angela Odom and Dr. Robert Graham, who's a doctor and a chef as well. And we had cooking class for the community. And as Dr. Snyder just mentioned, we also had Dr. Barnett, who talked about plant-based medicine. He's from the Rochester Institute of Lifestyle Medicine. So there were tons of learnings, and the participants gave us amazing feedback of what we learned and hope to put all those into action.
Okay. I have a question from that I'm going to come back and ask. And Beth, what was your takeaway about what the Food as Medicine and Symposium? And what was the date of this symposium? It was at the medical school. What was the date, and what was your overview of the day?
Yeah, this year was our 3rd year, Purnima mentioned, and it was so exciting because it wasn't just one day. Actually, this year we had 3 days of events, programs, engaging workshops, panel discussions. It was just last week in September, so it was the 27th, the 28th, and the 29th, actually. And the goals have been the same every year, really building that awareness, educate, inform, inspire people to get involved. And, those themes have stayed the same every year. We always bring in national experts to meet with our local leaders about talking about food as medicine and how we're integrating it into the various pockets. Every year we pick a different theme. So the first year we focused a lot on medical school education, food as medicine in integrating into the healthcare system policy. This year we focused a lot on teaching kitchens, as Purnima mentioned, culinary medicine, and lifestyle. So food is really important, but healthy living includes a lot more things than that. And so I'm really excited to see how lifestyle medicine and this movement is going to grow in Buffalo as a culture, because they all sort of piggyback and work together, a healthy living. So, if you're mentally taking care of yourself, maybe meditating, being mindful, being more aware, it kind of opens the door to being more active and creating those healthy choices. It's kind of like a domino effect. So I'm really excited to just keep building this momentum and see it grow in Buffalo.
Is this program free, and who can attend?
So it is free for students. We always provide it free for students, and we had a free community cooking workshop this year that was led by a registered dietitian. And then for nonprofits, we do provide a discount. So tickets, I believe, were $100, and we provided a 50% discount. So it was $50 for nonprofits to attend. And then if you were joining us virtually, you would receive lunch or some of the swag. So the virtual attendance was $50.
Francesca, though, what Buffalo Niagara Medical Campus and Beth and Purnima and the team offer is really the symposium is a culmination of each year long's worth of work and directed focus on categories of access, education, research, and larger wellness frameworks. And so, they support the over 17 neighborhood gardens, making sure farm to table are available locally to the communities around. And so there's, with all of the nonprofits that team engages with, there's always opportunity just to learn more about the Western New York Food as Medicine Coalition under their leadership. And that's where Beth and team continue to drive momentum in empowering our community members to be able to learn more and do more related to this. Dr. Helen Cappuccino is a strong advocate within the oncologic community and diet and researching that. Dr. Sarah Ventry with her pediatric patients is really doing incredibly innovative work. And we have a Dr. Smita Bakai who leads our preventative wellness program and medicine program. But I think one of the other major themes that builds off of what we talked about previously in terms of curriculum and education, we spend so much time in medicine thinking about disease and treating disease, we barely learn about what it means to be well. We barely learn about what it means to eat well and the importance of diet and nutrition. And so if our doctors and our educators aren't learning, how are we transmitting that to our community? And the Western New York Food as Medicine group have really championed that and helped empower us as providers to get the right information out to people. And that's a community resource.
That is. And, I remember attending the session, maybe it was last year, or maybe it was the virtual one where they talked, where the focus, there's a lot of focus on community gardens. And when I talk to people in different groups about health and being healthy and food, I recall a woman who had a garden, like growing tomatoes alongside her house. You know what? That was my aunt who grew tomatoes alongside her house every year. She didn't have a fancy garden, but she was able to can those later on. But I never even, but I remember the garden conversation. It would just seem so simple just to begin on the path to eating healthy. And I remember that. So of all the sessions, was there a session that was was there a session that was well attended and you just saw like the lights come on in the audience, like, oh my God, oh my God, oh my God? Or was that all the sessions?
I'd like to think, I feel all of them were that way, but I would say the one that probably got the most genuine and raw, rich discussion was how we started our day. And that was the food equity panel, because you can't have food as medicine if you don't have access to food in your community. And this has always been the beating heart, the foundation, every year, a topic of discussion that we are always sure to cover. The food environment and how we're all supporting healthy food options in the community. And so I felt that panel was just, we went over time, the Q&A just kept going, and it was such a rich discussion listening to everyone. And I'm sure Purnima has more to share, and Dr. Snyder too.
Yeah, I would agree with Beth in terms of the food equity panel being the most talked about. And also we also had a couple of farm tours this year that were really engaging, talking about locally grown, locally sourced, and we had that on day one of the symposium, and that was really enjoyable as well. Thank you.
Okay, yes. Dr. Snyder, how about you?
Yeah, I think the equity panel to me always is the most important, and what I again love about it is the honesty and the multiple sectors that Beth and team bring forward to this conversation, from community leaders to our Erie County Department of Health to our local insurers, and it always takes some time to process. But what the Buffalo Niagara Medical Campus team then is turn that discussion into something actionable. What I love about working with them and learning with them and partnering with them is that it's never just a conversation that then doesn't go anywhere. There will be, since the meeting, I'm sure none of them have taken a break in terms of processing the information, coming back, and then translating that all back to us in terms of here's what we're going to do about it. And that's what it is most exciting to me. And again, for our community members, I think it's a matter of understanding that this work is all happening multi-sector behind the scenes, and we would love for you to learn more and be engaged in it.
Well, you know what? That was the next question I was going to ask. This show is about information and education. So if there's a listener who is, he or she, their joints are inflamed and their belly is bloated and they're just feeling lousy, what can they do? How can they learn more about food as medicine? Who would they talk to?
Well, I think that's the simple thing that I would like to say, and then Praneem and Beth will actually give more granular information, is I like when we discuss the empowerment to our community members and in terms of what they need to ask as a patient. And so maybe the first time that one of our doctors are saying, I think you need to treat, and there are times when diet may not impact it and you've got to try something. But I want people to be aware of asking the question, Doc, if I tried to change my diet, do you think this might impact my need for a medication or to take a medicine? And I want them to specifically know that in addition to their primary care doctor, that there are certified dietitians that are exceptional in this area that may help them. So think about, okay, I understand that I'm starting to potentially develop this disease. I would like to meet with the dietitian or please help guide me in terms of a diet change that may impact this. That's what I want people to walk away from this with. Purnima, please, and Beth.
Thank you, Dr. Snyder. So in terms of awareness and information, I would like to share about the upcoming study that we're going to be working on. With the Blue Fund, we are working with Highmark on a food as medicine study where we will be looking for participants. We will be providing medically tailored meals, providing lunch and dinner. The study is going to be for 6 weeks. There will also be cooking classes involved. There will be mindfulness workshops talking about lifestyle medicine. And also there's going to be a software that they would be using where they will be able to speak with a dietitian and log their meals every day. So we're looking forward to start recruiting and encourage participants to sign up when they see the recruitment flyers out. So again, the Blue Fund Food as Medicine.
How? And is there an income and how would the listener find out and participate?
We will be posting flyers around the campus. We're also going to different tabling events and sharing that information. It'll be on our website. So there'll be different ways to register. There's a pre-screening. So once you answer that, we will get in touch with you and start the recruitment process and give you further information after that.
Okay, I hate to interrupt you, Beth, but this is on WAFO. And are you going to share it with that? And are you going to put, again, are you going to put information in the community newspapers like the Buffalo Challenger, the Criterion, because everyone would not even have a need. There's no need to go on the Buffalo Medical Campus for the most part. So I'm just wondering, how are you really reaching it into the roots of the community?
Yes,
just something to think about. You don't have to answer, but just something to think about.
Sure. Thank you. We would love to share that information.
Alrighty, great. And Beth?
Yeah, I echo, Purnima, everything that she said. We have so many amazing partners who we work with. So not just on the campus, but also in the community. So one of our partners, Buffalo Black Nurses, has always been a great support in our food as medicine efforts, Independent Health Foundation. So we really are able to expand our reach and reach a lot of people that way. But of course, we're always open to any new connections like Francesca, you or Clyde Health, if anyone's able to support so that we can reach more audiences. But we're super excited to launch the 40 Days to Wellness, and we think it's going to be really great. So anyone who's listening, please come to our website, bnmc.org, and figure out how you can sign up. We would love to have you.
Okay. And I just want to say, I would like to share it with NAACP, the churches, Urban League, my personal website. So if anyone, the Pan-Hellenic website. So once you have that information, if you could share it with me, and I'll make sure it gets to all the groups. which is reaching thousands of people. We only have a few minutes left, and I wasn't able to ask. Could you just, okay, real quick, is it important to eat 3 meals a day?
I'll chime in quickly, and then the others can comment. I think that depending on what you're choosing to eat, it may impact your glucose levels, cortisol levels within your body, and impact the ability or need for you to watch the amount of caloric intake you bring in. If you choose the right foods for your body, you don't necessarily need to pay attention to that. There are food choices where you don't need to think about limiting how much you eat or the time frame that you eat in a specific day. But if the choices of food that you're making are inflammatory or a dense caloric intake and other, then obviously limiting the total amount you eat within a day is important. Somebody said it also very well as simply. The formula for weight loss is not dramatic. Eat less and work out more. Okay. But there's also some significant nuance to that. If you choose the right foods, you don't need to think about or worry about when I'm eating or how much I'm eating, because the choice of that food that you've made is going to help take care of it for you with your body. Everything within moderation. But I would say that a dietitian is the best one to answer that question for each specific individual, depending on their current medical condition.
I would like to just say one thing about the 3 meals, if I can.
Sure, of course.
I like the statement always: eat breakfast like a king, eat lunch like a prince, and eat dinner like a pauper.
Why, thank you. Thank you so much. I also enjoy that, hearing that over and over again. But I have to say, our listeners, if you heard this program, I want to say one of the biggest takeaways today that has been medically proven and peer-reviewed is 2 weeks. 2 weeks is all it takes to change what you're eating, to possibly stop different medications, possibly, but just to bring your levels down. 2 weeks, correct? Team, is that a 2 thumbs up for everyone on the call? Dr. Snyder, Parima, and Beth?
Yes.
Yeah.
There you go. You've heard it. So I want to thank Dr. Snyder, Parima, Mohan, and Beth. Oh my gosh, Beth, tell me your last name again.
Macnica.
And Beth Macnica. I want to thank the 3 of them for part 1 on the Food as Medicine Symposium. We will have a part 2 sooner rather than later. And I just want to make sure you stay and listen to the second part of our program today. All right. Thank you. Thank you, Dr. Snyder. Thank you, Parima, and thank you, Beth. In the second half of the program, as I mentioned earlier, we will be discussing upcoming PSA, prostate cancer screening, taking place at the Reverend Smith Family Life Center on October 21st. And you may wonder, where is the Family Life Center, Reverend Smith? It is located on the property of St. John's Baptist Church, and that being 833 Main Street. And we're going to talk about how you can win a pair of tickets to the Bills, tickets to the Sabres, and this event is open to men and women. And again, the topic is PSA, prostate cancer screening. So first, Jen, we have Jen. So on this program, we have several people. We have Jennifer Hendel, who is with Western New York Urology. We have Jason Coleman from the American Cancer Association. We have Trustee Rodney, who is a trustee at St. John Baptist Church. We have Deacon Norman Anderson, who is a deacon. We have Deacon Rodney and Trustee Anderson, and both from St. John Baptist Church, as well as Deacon Winford Quick, who is also with Great Lakes, who is also with St. John Baptist Church, and our community leader, Larry Threat, who is a block club leader in his community. I'll let Larry say what he does once we start talking. But I just want you to know. So this is a program where we're bringing together our health professionals, our nurses, and our community, because it's the community who gets people out to the screenings. So again, our topic is prostate cancer. So Jen Hendel, could you briefly describe and introduce yourself and your title? If you could briefly describe the importance of PSA screening. What does PSA stand for? And especially for African American men.
Sure. First of all, thanks, Fran, for having me on, and also for inviting us to be a part of the event on October 21st. We're looking forward to it. My title is, I am with Western New York Urology Associates and Cancer Care of Western New York, and I am the Director of Clinical Operations for Cancer Care of Western New York. PSA, quite the topic. PSA stands for prostate-specific antigen. And unfortunately, when our prostate, or in men, it gets bigger, it causes this, it releases cells out into our blood system, which is what PSA is looking for, the blood test. So with that said, unfortunately, in the African American men, we see such a higher risk and we see higher rates amongst them. And that's why we find it super important for us to get out into the community and screen people. The main importance is having a physician and following up with them and making sure that you get your yearly checks. And another thing too is a lot of us don't realize, but we may have family history. And with family history, unfortunately, comes more, with the family history, obviously, comes higher risk. So with gentlemen that do have a family history, we really do encourage them to start screening prior to 50 years of age. And that's really determined between you and your physician.
Okay, thank you. And what age, Jason, what age does the American Cancer Association recommend African American men get screened?
Well, so I appreciate the question, Francesca. I'm Jason Coleman. I'm with the American Cancer Society here in Western New York, and I think Jennifer pointed out some interesting statistics, and I'll just throw out a couple more with regard to research here in the U.S. It does show that in the period from 2015 to 2019, the incidence rate for prostate cancer has actually gone up, and that's certainly concerning from a national standpoint, because prior to that, those incidence rates were going down, and a lot of that increase is happening in African American males. So Black men, they do have an estimated 70% higher incidence rate for prostate cancer than their white counterparts, and have a 2.1 times higher likelihood to die of prostate cancer than their white counterparts. Again, highlighting that disparity. So in answer to your question, Francesca, average risk males, according to the American Cancer Society, are recommended to be screened at age 50. However, just being African American puts you at a higher risk based on the statistics. So that recommendation begins at age 45. And furthermore, if that African American patient has first degree relatives, which could be a brother, which could be a father, that have been diagnosed with prostate cancer at an earlier age, and we use the term earlier as under age 65, then they would recommend screening to begin at age 40. So I hope those statistics, for those that are hearing this broadcast, really inspire them to either come to the event that Jennifer mentioned, or most importantly, to be seeing your primary care physician year over year to have those conversations about your risk. A digital rectal exam is normal protocol during an annual visit with your primary care provider, who then can have a conversation with you as to whether or not to go ahead and get a PSA screening based upon your risk level. So, an excellent conversation. I love being part of it. We, as the American Cancer Society, have a lot of resources around this issue, should you need more, at cancer.org. So there's a long answer to your short question, Francesca.
No, thank you. And next, thank you. And next, I'm going to ask Dr. Winford Quick. He's a medical doctor. Not only is he a medical doctor, he's also a member of St. John's Baptist Church, a deacon or trustee, but I know he's very active with the health committee. Dr. Quick, I have a question for you. Are you there?
Yes, can you hear me?
Yes, I can. Dr. Quick, in a couple of sentences, as a man of color, a physician, a member of the St. John's Church, why do you think Black men or African American men are scared to get a blood test? And we're talking for this event about a blood test, a simple blood test with the friendliest women in the world who draw your blood from Western Urology.
No, I practice medicine for 40 years, and it's been my experience with Black men, and it's even involved my son. I talked to him. The young man just mentioned the digital examination. A lot of Black men have difficulty with a man putting his finger in his rectum. I'm just going to be honest with you. And for that reason, a lot of them will not go for that reason alone. Similar with high blood pressure. A lot of the blood pressure medications will cause impotency. And for that reason, they won't take the medication. Say, Jesus, I'm dead if I can't do what I want to do. So those are two simple things I've found in my years of practice why there's a disparity with with blood pressure and with prostate. Now
we're just asking for a blood test. So how come they won't come in?
I know it's not out there.
Okay.
With the men with blood, I think that's what we have to do is talk to people. It's just a blood test. They would like to. Like I went to my doctor, and had mine done within the last 2 weeks, and because of my age and what my level is PSA, it says my age, I probably won't ever have to have this done again. And I said to myself, what a relief. Now, I'm a physician. I've been doing it for the last umpteen years, but it's there. I'm just trying to make it, bring it down to earth as to why I think in my years of practice, what I've seen. Now, I think, I used to tell them the blood test, but they want to do the exam just to find out the largeness of the prostate and find out if they need surgery, not necessarily cancer, other reasons. But I think that's, to me, what I've seen in my years of practice was the main reason.
Okay. All right. Thank you. Trustee Anderson, I wanted to know why. I mean, when we first started doing this, and we've been doing this free PSA screening with Cancer Association, Western New York Urology, St. John Baptist Church, Deacon, Trustee Anderson, why have we decided to open it up not only to community partners, but to women? What's the benefit? Trustee Anderson, you're still okay. You're on mute.
Okay, can you hear me now?
Yes, we can.
Okay, thank you for that question. First, let me make a correction. St. John is located at 184 Goodell Street, and the Life Center is across from the church. And our pastor and overseer, Michael Chapton, has enabled us and allowed us to be able to have this event with our Christian Men Fellowship. And we were glad to, first we started off with just men, but in the process, we understand that women have health issues also, and it's important that they get examined at the same time, and they will bring their husbands along. So those were one of the things we've been doing for the last 3 years, and prayerfully we'll be able to continue to do that with your assistance and everybody that's involved. So those are the things that we're working on, and hopefully we'll get a large amount of people to attend.
Yeah. Thank you. Yeah, because I just want to do, because you've been leading. You're the one who organizes the phone calls and keeps everyone together. So that's why, you've been leading this. Larry Threat. Larry is not a member of St. John's, but he is a community partner. Larry, what is the name of your the block club that you are responsible for?
It's called the block club is Field of Dreams. I'm sorry, Field of Dreams block club, the Fillmore district, in the Fillmore district, and we also represent Sperry Park CAO with our community group in our neighborhood.
Could you talk about the community screenings and what it's done for you and your family?
Well, actually, I'm a prostate cancer survivor, and I went through Great Lakes Cancer Care throughout my ordeal. I was diagnosed with prostate cancer as well as some of my friends and family. I accepted the diagnosis as having prostate cancer, and I didn't want to keep it a secret, and that's the key. Not keeping it a secret and letting everyone know, and letting my family members as well as my community and fellows and brothers in my community know that early detection is the key, and this is something that can be corrected if it's corrected early. And I've experienced, along with Francesca and along with Great Lakes Cancer Care and Kaleida Health, we've actually struck out and had several PSA screenings, trying to educate the men in the community that a blood test or PSA blood test will help them to direct them towards getting the help that they may need and may save their lives. Me personally, through our screenings in the last 4 or 5 years, there have been several people that I've personally associated as co-workers that work with me through National Grid that have actually discovered through our screening process that they had a problem going on with prostate cancer. Also, I have two brothers that actually came to our screenings and figured out that prostate cancer does run in my family, and has actually saved 2 of my actual blood brothers with this PSA screening. So it is near and dear to my heart, man, to get out in the community and spread the word and try to get as many men as possible to come in and do what they have to do to take the blood screening and take it seriously. As far as women being involved in our health event this week, the women is the key. Women are the key that push the men. We are very hard-headed and stubborn when it comes down to our health. We need our women. We need our women behind us to push us, to make us go. Women, they know their men, and they know that we are stubborn and hard-headed, and we need that extra push from our ladies in our lives. So I'm here, and I'm an advocate in the community to push towards prostate health, and encouraging all the men out there and anybody that listens to our program to please come out to our screening on the 21st at St. John's.
Thank you. Deacon Rodney, how are you this morning, Deacon Rodney? Oh, good. Describe to our listeners, what does it look like when you come in to the Family Life Center? And you know what? The ladies from Cancer Care, Western New York Urology, they are always early. So I must say, this event begins at 8:30. But if you know you have to be someplace by 8:30, I will bet, what's an expression? Donuts to dollars or something? I bet you they'll be there by 8:10, ready to give you the screening, and then your name will go into the drawing for Buffalo Bills and other different prizes, pair of tickets. So explain to our listeners, what does it look like when you park your car at 8:30 in the morning and you come into the Family Life Center? What does it look like?
It's wonderful because that they come in there and we greet them. So it's not like going to the doctor and it's all cold. And we greet them and we talk to them that they understand this is nothing, that you have to be afraid of. So we make that environment a good place for them to be to do these things. So, if we love the people, we want people to be healed and get health and wellness, and we do it well. So we want the people to come out.
Thank you. Now, I also want to say, before I talk about the Buffalo Bills tickets, can either Deacon Rodney, Trustee Anderson, or Dr. Quick talk about our speaker? And we do have a speaker that our pastor, Michael Chapman, was very, he recommended the speaker, and that's Lynn Riker, Director of Community Outreach for Hospice and Palliative Care. Could someone talk a little bit about our speaker and what she'll be talking about?
I can see a few things, Francesca.
Thank you.
This young lady is coming in. They teach people in the area, if they would like to become, there's a term that has, I can't, not on the tip of my tongue, but palliative care is taking care of those people who need to go into hospice or will have hospice done at home. People need to be trained, because a lot of people don't realize that when you're taking care of someone, it's very difficult when you have a life of your own and you're trying to take care of someone, maybe doing work, maybe take care of someone who needs care. You got children and grandchildren you're trying to help out with. So it helps to be trained. And this young lady does this for this part of the state of New York. And she's willing to come in to show how it's done. Those people who may want to become one of these people who take care of people, maybe taking care of their mother, grandmother, sister, brother, whatever, just to learn how to do it, what people to call when things happen, and exactly what the really nuts and bolts of being a palliative care person to take care of other people who need the care, who don't want to leave home. Sometimes they have no choice, but they only send you out to a home when you aren't able to do it at home. So it's just to show people how to do it and to ask all the questions. They want people to write down their questions. If you have a question, please bring it in, and you'll get help with taking care of your loved ones.
Yeah, and I have to say, and not to be afraid. I had a sister who passed away at home, and when she said she wanted to die at home, I mean, who was I to say no? Who, of course, right. But hospice prepares you, and they answer all your questions. They're there within a few minutes, and they work 24 hours a day, 7 days a week. So I just want to say that beginning at 10:45 is our speaker. However, if you need to be screened, you can come in at 10:45 for your PSA screening. So don't think that when you see the speaker, you turn away. No. You come right back in, and one of those friendly ladies will be more than happy with a smile not only to take just a test tube of blood, but when you get screened for this event, your name will go into a basket for raffle. We have tickets for pair of tickets for the Buffalo Bills game, for the December game. I know I told you guys which one it was. Do you remember which game it is in December? I forgot which one. But anyway, it's for the Bills. And for women, we are also going to have vendors there, and your name will go into a drawing for a pair of tickets to the Sabres game. Also, when you visit with the vendors and when you get screened, you'll receive a ticket, because we have other prizes. The first 20 men who get screened will receive a bottle of Josh Allen hot sauce provided by the Kaleida Health Foundation. So not only are we having fun, is it educational, You may walk away with a prize or just a bottle of hot sauce for coming through the door. And again, women can participate. We have Erie County Department of Health with the colon cancer screenings. We're going to have job information there from Kaleida Health, also other information from Great Lakes Cancer Care, also information on all of the services provided by Cancer Care of Western New York, because they do also provide services for women. And if anybody wants to talk about this event, anything I've missed that you wanted to add to what you've said?
Well, one of the things that we was talking about, Lynn Riker, she was actually telling us that a lot of people are not prepared for the end of life situations, and so people should come with their questions of how do you get prepared? What are the things that we need to prepare ourselves for something like that, so families don't be at each other trying to figure it out. So that's another discussion that's going to be a part of this lecture, and that's what I wanted to let people know.
Oh, thank you. Jen, anything about the screening and the ladies that you provide from Western New York Urology? How long does it take, and what if they don't have insurance?
Does not matter. That's why we're there. We're to provide a community, definitely community screening for all. And it doesn't matter if you have insurance, we will always take care of you. When the screening's super, super simple. You walk in, fill out information. We have receptionists and also patient advocates present at our screenings that can sit down and go over all the information and review with you. And if you have any questions regarding the PSA blood test, we also have a physician assistant available too to answer any questions. And the blood test itself takes, honestly, 10 seconds. It's no pain. I could guarantee no pain. We've got the best that definitely draw blood. So it is well worth it. It takes 10 seconds to save a life. And I think it's really important to stress that. And I know Mr. Threat would be the first to say it. And that's why we're out there in the community, and we will keep doing what we're doing to provide everybody the opportunity to make sure that their health stays on track.
Thank you. And I also forgot to mention, we're having snacks. So don't think you'll be there at 8:30 in the morning without a coffee or water or an apple. We are providing snacks for everyone. I wanted to mention that.
Well, just to piggyback, can I jump in there real quick, just to piggyback onto something that Jen said? I consider those ladies and gentlemen who take the blood work for us, to do the actual blood work and testing for us. I call them my angels. They are so friendly and they are so nice to you. And I just love having them with us and supporting us on our effort and trying to get the men tested. So thank you, Jen, for providing that service to our community. And we would look forward to seeing you on the 21st.
I look forward to seeing you and everybody out in the community. I really do. Thank you, Mr. Threat.
And Jason, can if you can't come, can you get some information just on cancer screenings? Can we connect
Absolutely.
for that?
Absolutely.
Okay, great. And I know I'll be dropping copies off at the church for this event, flyers to Larry. Anything else I forgot to mention for the program? No? Well,
everybody.
Pardon me?
Looking forward to seeing everybody.
Yes, on October 21st, Saturday, October 21st, screenings begin. I'm going to say they begin as early as 8:15 because those ladies are early and ready. And then our speaker begins at 10:45. Sorry, go ahead.
No, I want to say one thing. We just had our pop-up clinic there for COVID. So people might realize this is at the Family Life Center. A lot of people will still go to the church and is at the far end. As Brother
The far end
Norman
of the parking.
it's the far end of it's behind the church, at the far end of the parking lot. If you
And
go
I'm
to
gonna
the
even
church, right. I'm sorry. Go right ahead.
I was gonna say, and I'll get some balloons. We're gonna put some balloons on the door.
Okay, fine. Well, they
Yeah.
still go to the church. All right. Thank you.
I know. You're right. They do.
Yeah.
Our door winning for the door prize. You don't have to be there, but that's scheduled at 11:40 a.m. So you get screened. You'll get a ticket. Write your name on that ticket and phone number. Put that in the basket for the Buffalo Bills door prize. Also, when you go around and meet with the other vendors, this is where the ladies come in. Their name will go into the drawing for the Sabres door prize. And then the men who come in for the screening, you also get the first 20 a bottle of Josh Allen No. 17 hot sauce. And I just want to thank everybody. I want to thank Jen Hendel. I want to, from Western New York Urology, Cancer Care Western New York. I want to thank Jason Coleman from the American Cancer Society Association. I want to thank Larry Threat. I want Trustee Rodney, Deacon Anderson, and Deacon Quick. The last three voices, they're from St. John's. We're from St. John's Baptist Church, and it takes a village, and this is a village. I've never
we
had
want
this.
to thank you for what you do year
Absolutely.
after what you do year after year. You do works.
Yeah,
And
thank you.
Absolutely.
Yeah.
Thank you.
Yeah,
Thank you.
you are
Ton
the
of
glue.
kudos.
You are the glue, Francesca. You are the glue.
Oh, no.
Yes.
Thank you. All right. Well, on that note, I want to say goodbye, and I want to do a shout out. Thank you to Pastor Michael Smith, Overseer Michael Smith, Pastor Overseer of St. John Baptist Church in Gethsemane. I want
correction is happening.
Yes. Pardon me?
Is Overseer Michael Chapman, St. John Gethsemane, 2 churches, 2 campuses, 1 village.
1 village. And we'll see you October 21st at 8:15 for the PSA screen. Come and win those Buffalo Bill tickets, those Buffalo Sabre tickets. Thank you. Thank you, everyone. Thank you, Joe. And in 2 weeks, you will be hearing, next week, you'll be hearing from my colleague, Cindy Bass from ECMC. And in 2 weeks, God be willing, you will hear from me. Thank you. And everyone, have a great day.